Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bandura, and I endorse this clipboard product.
This is a presentation on the posterior muscle compartment of the thigh.
Here we can see the posterior compartment of the thigh. This comprises our hamstring group of muscles. So these tend to cross the knee posteriorly, therefore causing knee flexion. Many of these muscles also cross the hip posteriorly, leading to hip extension.
The posterior muscle compartment of the thigh can be thought of as the knee flexor compartment. As with all muscle compartments, boundaries include deep fascia, which binds all muscles, the lateral intermuscular septa, as well as adductor magnus, the boundary between the medial and posterior compartments, running between adductor magnus, between the adductor and the hamstring parts of that muscle. Common actions include knee flexion. Common vessels will be the profunda femoris artery or deep femoral artery. The common innervation will be the sciatic nerve, which is that nerve that runs down the posterior thigh. In particular, we'll be looking at the tibial nerve for the innervation of the thigh. The tibial nerve being composed of anterior divisions of the primary ventral rami, which are the divisions which cause flexion, adduction, and medial rotation. Flexion being what occurs at the knee for the posterior compartment. So we'll begin by looking at the adductor magnus. Again, we had an adductor part in the medial compartment and a hamstring part in the posterior compartment. So note that the hamstring part doesn't actually cross the knee. It crosses the hip posteriorly. So while we generalize and say that the posterior compartment might be a knee flexor compartment, not all the muscles in all the compartments do the common action. Most medially in the posterior compartment, a semimembranosus muscle, membranosus being most medial, and a semitendinosus. So semitendinosus is on top, so it's a little bit superficial if you have the opportunity to see on a cadaver specimen. And if you flex your knee and feel posterior, you can feel that we have two tendons in the posterior compartment running medially across that knee joint. Most medially we have semimembranosus, and a little bit more laterally towards the center of the knee we have the semitendinosus. Most laterally we have the biceps femoris. The short head of the biceps femoris doesn't cross the hip, so it's not a hip extensor. It's innervated by the common peroneal nerve, so it doesn't have the common innervation of all the other posterior muscles. So our biceps femoris short head and our biceps femoris long head, they basically blend together to cross the knee, and they're going to cause knee flexion. Anatomical spaces, we have the popliteal fossa. Now the popliteal fossa is that soft squishy bit in the posterior knee. The boundaries supramedially, we had those semimembranosus and semitendinosus muscles. These are our medial hamstrings. Supralaterally, superior and laterally, we had the biceps femoris. Inferiorly, inframedially, we had the medial head of the gastrocnemius. Laterally, we had the lateral head of the gastroc. So these make the boundaries of our popliteal fossa. Of course, deep, we have a floor. So that's going to be our popliteus muscle and the bone of the femur. Most superficial will have the roof, which as usual will be fascia and skin. Contents of the popliteal fossa. We'll have a popliteal artery and vein. These are continuations of the femoral artery and vein. So the femoral artery has traveled down that subsartorial canal, passed through the adductor hiatus, which is the space between the adductor part and the hamstring part of adductor magnus, and hiatus just means a gap, and so it's passed through there, and as it passes through the adductor hiatus and into the popliteal fossa, it changes its name to the popliteal artery. So it will be accompanied by the popliteal vein. The sciatic nerve has traveled down the posterior thigh. Partway down the thigh, it will separate into its component parts. The tibial nerve, which travels down the posterior leg, and the common peroneal nerve, sometimes called the common fibular nerve. And if we think fibula or peroneal, they mean the same thing. We want to think lateral. So these are going to run laterally. And wherever we have superficial veins draining deep, we're going to have popliteal lymph nodes. Wherever we have vessels, we'll have lymphatic vessels as well. So these are all going to be contained in the popliteal fossa. As well as that, wherever we have anatomical spaces with empty space, the body's going to fill it with fat, and you can see that there. The final thing we'll talk about is the pes anserinus, or goose's foot, so called because we have 3 tendons all coming together at one point from different angles, and it looks a bit like a goose's foot. Pes or pedal meaning foot, anserine meaning goose. So it's formed by the insertion of sartorius, gracilis, and semitendinosus. Sartorius was that muscle from the anterior compartment. Gracilis was that long, slender, graceful one from our medial compartment. And semitendinosus was that tendon-like one from our posterior compartment, one of those medial hamstrings. And to remember these, some people like to have a strong gin and tonic. Some people like to say grace before tea. Now what we have is an anterior muscle, a medial muscle, and a posterior muscle, all joining posterior to the knee. So they're all coming together. And this works to cause knee stability. Just like a tent. A tent wouldn't stay up with only one rope pulling in one direction. You'd need ropes pulling in each direction to counter any forces that might occur. The same thing's happening here. We have all these muscles inserting onto the same point. So these are all going to cause knee flexion, and they're going to stabilize that knee. This is our pes anserinus. It's a really good landmark to find, because if you find pes anserinus, you can determine sartorius, gracilis, and semitendinosus, which allows us to find our hamstring muscles. If we find semitendinosus, we find semimembranosus. And this is what they look like with the muscles cut away. Now that we've looked at all the muscles of the posterior compartment, fill in the following table, looking at the origin and insertion of each of the posterior compartment muscles, the innervation and blood supply, which joint or joints they might cross and the position relative to this joint, and this will tell us the action of the muscle at the joint. So do those for the semitendinosus and semimembranosus muscles, and the 2 heads of the biceps femoris, as well as the hamstring part of adductor magnus. As usual, put your answers on the forum and discuss. Thank you.